The second scenario or study design is unmatched case control. This model calculates sample size for the unmatched case control study. You enter the desired confidence level, power, hypothetical percent age of exposure among the controls, and either an odds ratio or a hypothetical percentage of exposure among the cases. Results are presented using matched of Kelsey, Phyllis, and Phyllis with a continuity correction. For sample size calculation of unmatched case control study, we consider a objective to investigate risk factor for development of diabetic retinopathy. For this purpose, we search the literature and article risk factor for diabetic retinopathy, a case control study. In this article, the nephropathy is the comorbidities with high odds 4.12. So we consider this factor. We open the unmatched case control study format and put the values percent of controls exposed, which is 18.75, and percent of cases with exposure, which is 48.75. For second case or objective, to identify associated risk factors of overweight and obesity among Pakistani university students, we search a reference article factor associated with overweight and obesity among Bangladeshi university students, a case control study. We consider this study for the reference article. Here table 1 for this article, the socio-demographic characteristics of the participant, and second table report frequency of food drink consumption of the study participants. We consider the fast food for the factor and use or consume 6 to 7 days a week fast food. The case percentage is 33.6%. Cases use fast food in 6 to 7 days a week, and controls 10.7% controls use 6 to 7 days a week fast food. When we put these values in the sample size calculation and match case control study, percent of controls exposed 10.7%, and percent of cases with exposure 33.6%. Our sample size for cases 34 and controls for 68, because we use the ratio of controls to cases 2. Total sample size is 102. Please subscribe and like our channel and press bell icon for more videos.